Wonderful. Well, thank you so much, everyone. Hello and welcome to the 2024 Department of Health listening session regarding behavioral health licensing. Thank you for participating this evening. Please note that this meeting is being recorded. My name is Eve Austin, and I am one of the executive directors for the behavioral health professions with the Office of Health Professionals at the Department of Health, and I will be facilitating today's listening session. Now excuse me, just 1 second. Now I'd like to have the other department staff on this webinar introduce themselves, and then I will give some instructions for using Zoom. After that, we will hear a brief presentation on the department's efforts to improve the credentialing process. And then I'll move to a presentation on the recommendations we made in December to reduce barriers. We'll then follow up with a listening session and gather your comments. When we have about 5 to 10 minutes left in that section of the meeting, we will wrap up with comments and I will provide a quick overview of our next steps. With that, I would like our panelists to introduce themselves as I call upon you. Shauna, would you like to go first?
Good evening. My name is Shauna Fox, and I'm the director for the Office of Health Professions. Thank you for being here tonight.
Thank you, Shauna. And then I'll pass it to Harold.
Hello, I'm Harold Wright Jr. I am the Deputy Director of the Office of Health Professions. So glad to be here with you as well.
Then I'd also like to introduce Joe.
Good evening, everyone. My name is Joe Miller, and I am Eve's counterpart in behavioral health. I'm the other Executive Director of Behavioral Health with the Office of Health Professions.
Thank you so much. We do want to note that there are several more DOH staff on this webinar tonight, including program managers for all impacted professions and representatives from customer service. But in the interest of time, we will not have everyone introduce themselves. If you would like to contact any of the program managers, their contact information is on the second to the last slide of the slide deck, which was also shared with registrants on Monday. Before we begin, we wanted to provide some basic instructions for how to interact with Zoom. You should see a control panel along the bottom of your screen. If your mouse has gone inactive, it may have minimized itself, so try shaking the mouse, and if you do not see the control panel. On the far left of your control panel is a button to mute and unmute yourself. The button is currently inactive, but we will enable your microphone if you raise your hand to speak. Toward the center of the control panel, you will see buttons to open the list of participants, the question and answer box, and the chat box. To the right of your control panel are options for closed caption, interpretation, and reactions. When we call for folks to raise their hand, you will find the raise hand button in the reaction menu. We're also providing American Sign Language and Spanish interpretation for this meeting. ASL interpreters should be pinned to your screen. If you cannot see the ASL interpreters, please put that in the chat and one of our team will enable that. If you would like to switch your audio to the Spanish interpretation, click on the globe-shaped icon in the bottom right of your screen that says Interpretation. Underneath it, and select Spanish to hear the translated audio. I would also like to remind everyone, if you are like me and a fast talker, please try to speak slowly to make things easier on our interpreters. Also, our videos are turned off for attendees by default. If you need access to share your video, please put that in the chat and we will enable that feature for you. And Zach, if you want to start queuing up your presentation, I'll just continue with a brief note here. The Office of Health Professions recently started a merger absorbing the credentialing function in an effort to support our credentialing process improvement. It has been a great pleasure to be a part of our credentialing process improvement group. I now support our agency-affiliated credential types for CARS, CALS, and CAC, substance use disorder professionals, hypnotherapy, ABA, LABA, CBT, certified counselors and advisors, and the future credentials, behavioral health support specialists, and our peer support credentials. My team of program managers who guide the professions have merged with our credentialing staff on March 1st. I am proud to share that we have improved communication, increased collaboration, and are seeing data-driven results in declines in our credentialing timeframes. And of course, my story is only one piece of OHP and only one experience. And I will share, we will continue to support these credentials in the next weeks and months to decrease our processing timeframes. I will now turn the floor over to our Office Director, Shauna Miller, and the team to provide an overview of the work we've all been performing. Shauna?
Hi. So thank you so much for being here again. I want to start by saying that this listening session is really about recommendations for changes to statute or rule that will decrease barriers to credentialing for behavioral health. However, when we had our last set of listening sessions last year, we also heard a lot from you all about how our work itself and working with the department was a barrier for some of you. And we took that very seriously. So over the course of the last year, we've been involved in some very serious process improvement efforts around improving our credentialing timelines, including improving our communication with our customers, and really getting some good data around the way that we measure our performance. And but we started this project with a pilot. The first profession we looked at was psychology. Last year, we had a lot of challenges around the psychology program and a lot of complaints about our timelines. And so that's where we started our pilot. And I'm going to turn it over at this point to Harold and Zach. Zach hasn't had an opportunity to introduce himself, so he'll do that now to tell you how that went. So Harold and Zach, take it away.
Thank you, Shauna. Yes, Zach will introduce himself when he comes on. But as Shauna just described, we had a lot of challenges in terms of the credentialing. And so we were afforded the opportunity to engage in Project Pathway with psychology as a way to look at some things that had some complexities around it, had some challenges around it, to see what we could learn from it in order for us to build out a better process and a more efficient process. So we took psychology. And in psychology at the time, credentialing was very complex. And we knew that there were timelines that were very long. In psychology, it requires multiple offices, as well as the examining board of psychology being able to engage in conversation. And it needed to start in a very early process. And if it didn't, it sometimes could get disjointed. The EBOP also has an independent authority. And it has its authority, but DOH produces credentials on behalf of the board. And so there was some disjointedness around the communication around that process. And so with those, and there were some others, we figured that we needed to figure out a process or improve a process that would bring those in alignment so that we could expedite or at least have a process that can provide support to the credentialing process. And so we kicked off Project Pathway. And what we found is that we wanted to get everybody under one leader. And I had the opportunity and was afforded the opportunity to be that leader. And then I was also afforded many resources that focused on culture, it focused on communication and the data. And as I said, one of those resources was Zach Patnode, who's going to come on and talk a little bit more about the approach. That.
Thank you, Harold, and thank you, everyone. I'm really happy to be here. I am Zach Patnode, and I use he, him pronouns. I am the quality administrator with the Office of Health Professions. It's a fairly new role for me in the office, but I'm a member of the leadership team alongside Eve and Joe, and previously served as the program manager for psychology and a leadership role alongside Harold in this pilot piece. And so to all those points that Harold brought up, we brought a team together of individuals from the program side of what we do and the credentialing side of what we do into one team in a way that historically has been separated across two different offices into one team, where we began to look into our data tools, the function of our non-routine processes and our routine credentialing processes, our forms, our website, the information that we were sending out to applicants throughout the process, and look at opportunities to make improvements and make those work better for our customers. And most importantly of all, it works, and we have data to indicate that it works. So the first result piece was specific to non-routine applications, which are those that require additional review by the board of psychology, usually a representative or a team of 2 representatives looking at an application because of education or supervised experience that doesn't match up black and white to the requirements and needs the expertise of a psychologist to make a judgment in those areas. This is an area where many of our most egregious, shortfallings in timing were coming out of, and so we wanted to focus specifically here. And so you see on the left, the total non-routine with board count showed a drastic reduction starting up around 54, reducing as far as 12 and maintaining in that area since approximately late October of last year. The maybe even more important part, though, is on the right side under the non-routine process status count. That red line starting up at 31 were individuals who were waiting in line effectively to be seen by the board. That number has reduced around that same timeline from 31 to 0 and has maintained. So today, any application that gets deemed non-routine and shows up to the board could potentially be with a board member review team that same day. So while the process may still take longer, there isn't idle time waiting for that review. We're really proud of that particular accomplishment. And then larger frame looking at this, during the tenure of the project, we both focused on cleaning up aged applications that had, for one reason or another, become stagnant, whether that was because of lack of communication with an applicant or misunderstanding of what needed to be submitted, or purely lack of follow through on either side of the relationship there, while also trying to work more effectively and efficiently at applications that were coming in brand new during the project. And the data that we have suggests that we were equally successful in both areas, issuing 121 aged licenses and 123 new licenses received during the project, with new licenses averaging 90 days total turnaround time. And again, with an average, some of those may include non-routines that include this extensive board review, while others may be folks who are coming in already licensed in another state through a more expedited pathway. And so those things shake out in an average around 90 days. And so while we learn from this, psychology is not the same as all professions, but has many similarities or pieces that in common with our other credentialing professions that are out there. And so we're able now, as of today, to have scorecards like this that mirror in ways what we did with psychology and look at our data of applications, what phase they're in, total numbers, how that lines up to our timelines, how we're trending over time, right sizing our goals to line up with an ideal timeline for each profession. We've made gains in these areas to really have clarity on how we're performing and whether or not the changes that we're making will have the positive impact that we're looking for. And so I'm going to kick over to Harold now to talk a little bit about some of those changes on the people side of things, because while these tools can be very, very important, the lessons that we learned about how we do the work and how we think about the work and how we talk about the work are equally important. So thank you. I'll kick back to Harold.
Thank you. And exactly right, Zach, is we have these tools, but it's using the tools in a way that moves beyond just transactional to more transformational. And so we had to really talk about our cultural interpersonal framework of how do we see our work? How do we construct and reform systems, culture, and language and take charge of the licensing process from our end? We knew at the time that the current procedure didn't meet the need, the long wait time. So what do we need to do to impact that? How do we change it and continuously improve were the questions that we were asking from one another. We had the data-driven tools. We had to make the invisible visible in order for us to identify pathways that we need to do or shore up to expedite the process. The way we talk to our customers matters. Instead of saying to folks that they're deficient or they're incomplete, what about it's pending? And what do we need to do to work more collaboratively to ensure that process works a little bit better? Because we're all, especially we know the governor's creed about access to care. How do we all work together, ensure that we get people into direct service? in a safe and healthy way. We need to maximize partnerships with the associations, the boards, the commissions. And then we need to evaluate the issues, implement improvements previously raised but weren't necessarily addressed. These are opportunities now to address those things. These are the processes that we used in terms of matching up with the data to reimagine the work that we're doing now in terms of our credentialing reorganization. So where are we today? So we had teams that transitioned March 1, April 1, and we just transitioned our last groups of teams today. Today, we just got finished with our last transition. And we had some great early accomplishments. And not only do we could say anecdotally that we do, we can show you the data. And that's something that's really important to us right now. I'm gonna let you read through some of the earlier accomplishments. Next slide, please. Now, what about the next steps? Where are we going from here? We got a lot of work to do. We're going to continue to work on our initial scorecards for all the credentials on a weekly cadence. More so from what it used to be a monthly, and we're able to get it back to a weekly so we can see it as it's happening. We can set meaningful targets. We then, after that, can pursue more detailed data as resources allow. What are we looking at? How does this work? We can be asking those questions. Policy alignment is another important piece that we're working towards. Our technology evaluation. Our staffing and resource allocation. How is what we are doing tell the story of what staff we need? Do we need more staff? Do we need less staff? What does it look like? We can get to Stacy's and look at the data and it can inform us. And then again, the constituent engagement. We must be able to get information, just like Shauna said at the beginning. We understand what the barriers were. That's why we worked on them to try to figure out what we could do to maximize this process. But we have to continue to do that. We have to continue to engage with our constituents. Helms Life. I'd like to bring our leader back, our office leader back on to talk a little bit more about Helms Life. And thank you again for having the opportunity to spend this time with you.
Thank you, Harold and Zach. So I just wanted to talk a little bit about one of the improvements that's coming our way. And so effective April 24th, our new data management system, which is called Helms, launched with its first release. Helms is going to launch in 3 releases and will hopefully appreciate a lot of improvements for the experience of both our customers and our staff who work in the system. With the new release of Helms Lite, the only folks who will see that will be people who are applying for a new credential. Those who are applying for a new credential will still go through the SAW system, but they will be connected with Helms and they'll be able to do things in the system that they were not able to do prior to this launch. So now they'll be able to use mobile devices, be able to make edits, begin to delete applications, attach their documentation and print a receipt. So this is up and running and we're already seeing a lot of improvements. The next release of Helms will occur in December of this year, and then the final release sometime in 2025. So we're really excited about the improvements from Helms and hopeful that that will further add a lot of efficiencies to our workflows. Just one reminder, there's our contact information. So if you'd like to reach out to any of us, we can certainly send you the slides. I know there's questions in the chat about the slides. If you email any of the 3 of us here, we can send you the slides as well. We'll also get them posted on our website. And you can reach out to any of us for the, if you have questions, comments, or concerns about this process. I want to just remind you all that although we are very interested in your input about our internal processes and there'll be opportunities to engage in process improvement, this listening session is really focused on potential changes to rule and statute that can impact and reduce barriers to licensing and credentialing. So I'm going to hand it back over to Eve. Thank you so much.
Thank you so much, Shauna. And just really quick, I'm just verifying that you're all able to see the screen.
Solo quiero asegurarme de que todos estén viendo su pantalla.
I Excellent. I'm going to assume that you are all able to see the screen here briefly. So let me just go back here. So again, Shauna, thank you so much. Harold, thank you so much for sharing all of the quality work that is happening with OHP. Now for a couple of brief slides on our 2023 recommendations for statute and rule changes to reduce barriers to become licensed or maintain licensure. I want to thank everyone who participated in our 2023 listening and feedback sessions. Your thoughtful comments and feedback helped us identify major hurdles and develop the recommendation I'm about to share that ultimately became law during the 2024 session. The slide shows the recommendations the department made for statute changes to reduce barriers. All of these recommendations were adopted as part of the engrossed second substitute House Bill 2047, except for the recommendation to adopt the Social Work Compact, which was included in the substitute House Bill 1939. Effective June 6, 2024, the limitations on the number of renewals for master's level counselor associates and substance use disorder professional trainees will be eliminated. Limitations on training locations for substance use disorder trainees will be removed. Time limits for earning supervised experience for substance use disorder trainees will be removed, and an allowance for master's level counselor associates to continue providing services to established patients while their application is pending becomes effective. Effective October 1st of 2025, a new credential for psychology associates will be available. The Examining Board of Psychology is granted authority to create standards for licensure without exam that reflect the applicant's professional experience. Continuing education requirements for master's level counselors will be moved to rule instead of statute. And the requirement for marriage and family therapist associates to have a portion of their supervised experience under a supervisor with 5 years of experience will be reduced 2 years to align with all other master level counselor professions. Effective January 1st, 2028, agency affiliated counselors will be eligible to practice in federally qualified health centers. As mentioned briefly, Washington has also joined the Interstate Compact for social workers. The effective date for this change depends on actions in other states' legislatures, so we do not know exactly when this will be effective. However, we do know that we've guaranteed 6 states, but it has now turned into 7 and have adopted the compact, with approximately 20 other states having pending legislation. The department also made a number of recommendations for rule changes in 2023 recommendations. Section 6 of engrossed second substitute House Bill 1724 requires the department to adopt the following changes via emergency rule by July 1st of 2024. Emergency rules are short term, so each project on this and the slide will also begin permanent rulemaking as soon as possible. All these projects will have public meetings for input from interested parties, and we share those invitations through our email service GovDelivery. We encourage you to join the GovDelivery list for any professions for which you are interested in getting notifications of workshops or rule hearings. To join any of our GovDelivery lists, visit our website at doh.wa.gov. Scroll to the bottom of the page and click on Sign Up for Updates from DOH. First, we have several rulemaking recommendations for substance use disorder professionals and trainees. The department has drafted emergency rules as required by engrossed second substitute House Bill 1724, and they are currently under review. We anticipate emergency rules will be filed and effective in early summer. The department has also filed a CR 101 to begin the permanent rulemaking process. Here we have the rulemaking recommendations we made last year for the master's level counselors and psychology. The master's level counselor program has held workshops and drafted emergency rules, which are currently under review. We anticipate these rules will be filed and effective July 1st of 2024. The department will file a CR 101 to begin the permanent rulemaking process in the next few months. The Examining Board of Psychology has also begun rulemaking on these recommendations. The board is working on drafting emergency rules to implement the recommendations and anticipates finalizing those rules at their May 17th board meeting. We anticipate those rules will be filed by July 1st of 2024. Board staff are also simultaneously working on filing a CR 101 to begin the process of permanent rulemaking. They will hold workshops in the coming months, so if you're interested in learning more or participating in those workshops, we encourage you to join the Psychology Gov delivery list. We would also like to note that we heard many serious concerns in our 2023 listening sessions about bias in social work or the ASWB exam. We did not have time to sufficiently study the issue and make a recommendation last year, but we have been working hard with a group of interested parties in the interim. We will have more information to share about this when we convene again towards the end of the summer to gather your feedback. Today, we are seeking your input to determine what rules or laws continue to present barriers and what barriers persist that we are not able to recommend solutions for last year. Your feedback is essential to us. It will help direct our efforts and make recommendations to the legislature for additional statute or rule changes to reduce licensing barriers for behavioral health professions. Now we have a few items we'd like everyone to keep in mind during this listening session. Please be mindful and respectful of all attendees and staff. Please raise your hand if you wish to provide verbal comment, and if applicable, state the name of your group or association you represent. Due to the number of participants, please limit your comments to 2 minutes to allow everyone to speak. Also, please try to stay on topic of behavioral health licensing barriers. We will keep this slide up during the public comment period for you all to reference the guiding questions we have provided. Your comments do not have to be specific to one of these questions, but please keep your comments to things the department has the authority to address. For example, we know provider salaries pose a significant barrier for some professions, but the department does not have the authority to affect provider salaries. Also, we want to note that we are here today to hear from you. We will respond to technical questions or if anyone needs technical assistance on the Zoom, but we generally won't be responding to other questions during the Zoom. You may put questions you have in the chat or Q&A box, and we will collect them and try to follow up after the meeting, or you can email the program manager from your profession. We have listed the names and contacts of them on the second to the last slide. And as a reminder, we are recording this meeting. If you wish to share your comments verbally, please raise your hand using the Zoom hand raise feature, and we will call on you in the order that your hand went up. If you do not have your voice recorded, or if you do not wish to have your voice recorded, please type your comments into the chat and we will collect them for review after the meeting. You may also send your comments to Corey Tarswell via email by Sunday, May 19th. And with that, we're going to shift our meeting and invite public comment. All right, I see Eric Olson.
Good evening. So my name is Eric Olson. Can you guys hear me?
Yes, we can.
Okay, so I just recently moved to Washington from California, and I've been a substance use counselor certified since 2005. And I found it very difficult to transition my certification to Washington because according to the statutes, it says that Washington recognizes California's CAP, which is the Counselor Consortium in California, but not like the other thing that I was registered with. So I was with CAP, and then because of the way that they do renewals, and it took so long, I moved to something called CAD-TP, which is identical. And I ended my CAP certification in 2017. Now I've been certified for 19 years, at one point even nationally recognized with an ADAC, but due to it not being advantageous and costing a lot of money, I didn't do it. I didn't continue it. So now Washington, asks for all of your schooling from way back when, which is now over 20 years. So there's no syllabus to match some of the stuff that's today. So unfortunately, I'm kind of stuck where I can't seem to transition and get certified in Washington. The only good news is I work for a tribal entity, and due to self-determination laws, I can actually work there, but I can't supervise after having, 20 years experience as being an SUD counselor. So it's very frustrating because I can't come up with the curriculum from a California State, university where I took the drug and alcohol schooling, because I was under a different, credentialing, in California. I can't seem to transition. And again, I've never had it revoked. I've never had one day where I wasn't a certified counselor and going on 20 years. So it doesn't seem like it's really working. So I'm kind of stuck, but I mean, I would have had to move back to California if the tribe didn't accept me and allow me to work on reservation and continue doing the work that I normally do. So I find it very frustrating.
Mhm. Well, Eric, first and foremost, thank you for your service in working in this field. We're grateful for that 19 years of service helping communities. So first and foremost, thank you for that. And just to kind of hear a little bit more about your experience. So you're indicating just the barriers that you encountered were quite challenging. And then I also heard NADAC, that you at one point in time had NADAC certification. Is that correct?
Yes, because we're talking back in 2005 when I became certified, I went to CADAC in California, which was identical with NADAC, and so you actually got grandfathered into NADAC just because you became a CADAC certified counselor. And so I held that for, a lot of years, but it wasn't advantageous. It didn't allow for an increase in pay or anything. So I dropped it. And eventually CADAC stopped, doing, for whatever reason, they couldn't do any more credentialing. So then we moved to like the CAP and then eventually CADTP and vice versa. But again, like every single time we had to relocate or move because of something that entity hadn't quite, accomplished or whatever, we just renewed our certification somewhere else. So now Washington says, when they looked at my transcript, since they can't have a curriculum and actually review it, they think like I have to go back to school, which totally negates the whole point of 40 CEs every single 2 years, which is like, about 800 CEs since then. I mean, the whole point for continuing education, it kind of defeats the purpose when somebody says, well, based on what you did back in the 2000s, you didn't look like you went to enough schooling. That's like telling an MD, you went to school in the 80s, but we need you to go to school again to practice medicine. It doesn't quite equate. So it's a little bit on the frustrating side for sure.
Well, thank you for sharing that. And again, a lot of that feedback will be under consideration as we move forward. I do want to just mention, I would love to connect you with Claire Wilson. She's one of our program managers for SUDPs. If you will put that name in the chat, and I'm just going to look at one of my counterparts.
I've spoken to her and Ted Dale, and again, like last time I checked, it said that I probably have to attend another quarter or semester of school, etc. So right now it's like I'm going to keep my California certification and just work on tribal land for right now, and then weigh my options. I mean, I moved here just because I heard of 167% increase in overdose deaths, and I get to actually work with the tribe, which I've always wanted to do. It's a passion of mine to help Indigenous people. So, but I think I'm going to have to stay with California because right now I'm a clinic director of a brand new OTP that's opening, and I just can't see myself being able to float that and go back to school.
Right. Well, please stay in touch with our program managers as we continue to take this path with rulemaking. So thank you so much for your feedback, Eric, and thank you for your service and helping Washington right now.
Thank you.
Heather.
Hi there. My name is Heather Moselle. I'm not sure how to turn my video on or if I should do that here. Okay, so I guess you just see my initials. That's all right. I just wanted to make a comment on section 7.2, the stipend for associates. My hope is that that stipend for associates could cover the cost of accruing continuing education units while they're practicing as an associate clinician, and that the CEUs could be provided by the Department of Health at no cost to the associate clinicians. For example, the telemedicine training which is required for all providers using that format. That's available for free, and a link to it is publicly available on the DOH website, which is really easy for new clinicians to access. This is an excellent resource and it's easy to find on the website. My hope is that that stipend could cover some trainings and expand free trainings to obtain CEUs, or that they could be highlighted or marked if they are free for the suicide prevention training that's on the model list on the website. So if it could specify which trainings are free, that would allow associates to either complete the free ones when they do that 6-hour suicide prevention training, and if not through an outside program, similar to how it was with the telemedicine training, if it could be done through the Department of Health. At this time, it's about $100 to $175 to complete the 6 hours of suicide prevention training. If you use one of the resources on the model list. So if there is a totally free training, it'd be difficult for those clinicians to find because there's not an indicator like in the way that there are columns for cost or provider or setting, provided by or setting. There's not a column for cost. So if that could be added, that would be incredibly helpful. Thanks.
Thank you, Heather. I appreciate those comments and requests for kind of an expansion to the stipend, and then also looking at clarifying options for trainings available potentially within DOH and or clarifying our existing resources to include cost. Thank you. And team, if I'm missing anything in the chat, please let me know.
We're monitoring and responding as they come through.
Thank you.
We have a hand raised. Heather?
Hi there. Thanks, Steve. Thanks, Joe. I didn't want to take up too much time. I didn't know if there were other hands waiting, but I had one more point that I wanted to make on that stipend for associates. Another thing I was hoping that it might be able to be used for would be covering dues for at least one annual professional organization's membership fee per year while the clinician is practicing as an associate. Once they get the full independent licensure, of course, it's understandable that that wouldn't continue to be covered by that associate stipend, but the memberships in multiple professional organizations, they're highly encouraged during graduate studies. And then when you continue on, at least keeping one professional membership post-graduation is pretty much expected. And so while we get student membership rates while we're in graduate school, and that gives some relief for students who need that kind of support, that disappears once they graduate. And so when they graduate, the fees increase and they go from $80 to $190 or more a year. These are just the ones that I'm familiar with. The American Counseling Association's annual fees are $189 a year. And associates make about half of what fully licensed clinicians make. And for some associates facing socioeconomic or other hardships, this is a membership that they might end up letting lapse without that support. So it'd be really wonderful to see them be able to access the continued support that they get from that professional membership, they connect with peers in these organizations, get publications which further education and competence. And then many of them also provide free or reduced cost access to training and some continuing education credits. So that's all I got. Thank you.
Thank you again, Heather, for that feedback, comment, and advocacy.
We have Jim.
Jim.
Hi, thank you. I work in a federally qualified health center, and we've been struggling with, and I apologize, I don't remember the RCW number or the WAC. I think it's a WAC, but for mental health licensure, there is a requirement that to be able to treat children with serious emotional issues, that you have an additional 100 hours of education or work under somebody who has been licensed to treat children for a year. This requirement is also stipulated under ethnic minorities, people with disabilities, and I'm forgetting the other one. This is a real barrier to being able to treat the entire person. Community health centers in the state of Washington typically care for the entire person and work in an integrated system. And we do see children of all ages in primary care, dental, and this is really limiting and has siloed the ability of people to provide care. There's an attestation that is required that providers are really hesitant to sign if they haven't had those specific trainings, although we have children walking into our clinics all of the time. Anyway, that is my comment. Thank you.
Thank you, Jim. I really appreciate your service to our communities. And thank you so much for that feedback of your experience observation. We appreciate your comment and for coming tonight. And I believe I see Reba Harris.
Hi, can you hear me?
Yes, we can hear you.
Wonderful. Thank you. So there's just a few things I wanted to mention. I know for myself, just moving up in the ranks from SUD, from being an SUD counselor to moving into a therapist, MSW, just going through the many dynamics of continually putting my application through many times, regardless if my information is there, nothing has changed other than my address. But yeah, just constantly going through that process. But what I do recognize is that going through this process of the fees to pay for your licensure, the fees to pay for if you have to get somebody to oversee the time, a supervisor, to get to see for, if you don't have a supervisor at the time, if your job doesn't pay for it, the books and the materials and the studies and having to pay for the test. Not to mention when you're looking at those of maybe more disadvantaged backgrounds and more Black and brown communities of people who are challenged to pass these tests. I'm just trying to really see where we at kind of with making some supportive changes and really not have to enter into the ASWAB world of learning. A lot of times it's not reality when you're working in the social work world. if you read the answers and the questions, it's not really what we actually do. But I'm having to learn to do what I would do in a Eurocentric world, possibly. Yeah, I think that's really hard when I'm looking at it from that perspective. And there's just a constant pain for these licensure fees. We give a lot of our time and being thanked for our service, but it's a lot of time and energy. And the SUD, the licensure test, or the licensure fees is astronomical on top of having to pay for an MSW licensure too. That's all I got. Hopefully I got some feedback and get some feedback from that.
Thank you so much, Reba. And there's help is on the way for SUDPs with thankfully some of the pieces that passed in this last session. So you will be seeing fees reduced substantially for SUDPs down to $100, which will be starting very soon. And you'll see some information tied to that coming out via GovDelivery. So I do strongly encourage you to be signed up for our GovDelivery if you're not already for SUDP and then also for MSW. There's a lot of good conversations that are going to be continued to have. And we would love to have participation from all of you that have joined tonight, joining those things. So thank you, Reba, for that feedback, some of the socioeconomic barriers to fees and how much you're actually earning in these roles and providing services, behavioral health support to Washingtonians. So thank you for that feedback.
Perfect. And sorry, are you still there?
Yes, I can hear
Oh,
you.
sorry. I'm sorry. When I seen you glow off, I thought, oh, it's done. What about on just knowing more about the testing portion of things and how that interferes with, a lot of us trying to get past our test to get licensed?
Yeah, so for the ASWB, as kind of shared, there are many focus work groups working on this, interested parties. And again, that feedback is going to be shared towards the end of the summer. So signing up via GovDelivery, especially for social work related GovDelivery, all tiers, we will be talking specifically to social workers about the ASWB. Next steps, ideas in that next session towards the end of the summer. So please stay tuned. There's a lot of hard work going into some of these conversations and thoughts. So we appreciate your feedback.
Thank you.
And we'll just say I'm really good at silence, but please raise your hand if you have any questions or put them in the comment section. But I will give us roughly here 5 minutes to see if we have any additional hands that would like to speak tonight. Wonderful. Betty.
Betty.
I have often been the fly in the ointment, pointing out things, but I want to say thank you for all the work that you've done. This is really exciting for me. While there are still things that need to happen, bravo.
Thank you, Betty. We're so glad you're here tonight. Wonderful. Heather.
Thanks, Steve. I had a comment about the license and credentialing barriers that prevent clinicians from staying in the behavioral health field and from getting in it to begin with. I think that cost of supervision is really prohibitive for many. You know, I have access to a lot of types of privilege, and I have seen time and again how without having a partner who has access to a stable retirement, where we know, our bills are going to get paid. If I hadn't had that at a number of points, I don't know how it would have been sustainable to stay in making 50% of your income. And for some people, 50% or 40% of your income is a 1099. If you don't have benefits, if you don't have health care, this is just not really sustainable for a lot of people. And if you have health care, like I am grateful to have as a veteran and a military spouse as well, if you have access to this stuff, then you can handle those blows when you have to pay $189 for that annual membership and $84 for another membership. And looking at all these fees in front of me on my board, $60 for an LLC, $49 for an EHR software, Psychology Today, $30 a month. I mean, this stuff really adds up. And for people who don't have access to a partner with financial, stability, it can be so prohibitive to remaining in behavioral health. And I think when it comes to supervision, there should really be limits on how much money we ask of the people that we supervise. 50 or 40% of another person's income is a lot of money and maybe too much. That's all I got. Thank you.
Appreciate your feedback, Heather, about advocacy, and then also just kind of calling out some of the barriers that people encounter, and again highlighting some of the pieces that are happening with our stipend program. And we really sincerely hope that elements of that get funded to be able to support individuals in the coming years. So.
Excellent. Thanks, Eve.
So I'll just pause for one more moment here if there's any additional takers for the next minute before I will move to the next portion of our conversation tonight. All right. If you have comments you would still like to share and weren't able to do so at this meeting, we still have one more meeting coming up. So please send them to myself, Corey Tarswell, or any of the program managers that are applicable, or feel free to attend again one more session tomorrow morning. So with that, we're going to keep moving forward the next portion of our conversation. But again, I just really want to thank you all for your heartfelt thoughts, words, and sharing that and your advocacy tonight. So thank you for your participation. This information will be very helpful as we work towards draft recommendations for improving the behavioral health licensing process. And again, we have that one more listening session tomorrow morning, which will conclude our listening sessions. Our team will then spend the next few months reviewing these comments, researching, and drafting preliminary recommendations. We plan to reach back out to all of you in late summer to get your feedback on the preliminary recommendations before we present them to the legislature on or around November 1st of 2024. I will also note we have created a web page for this work, and we'll be posting recordings of these listening sessions in English and in Spanish to our webpage, as well as a video of our ASL interpretation. We will send out an email via GovDelivery with a link to that page shortly after the listening sessions have concluded. So before we go, I would like to thank our wonderful interpreters for all their hard work tonight. We appreciate your time as well, and thank you all for working to make a more accessible Washington that is available for all individuals. So thank you so much for everyone who participated tonight, and I hope this has been a conducive conversation for you all. And please note the contacts for some of our program managers that we discussed tonight. Take care.